Hey, hello friends. Yeah, welcome back again in podcast with Dr. Priyanka. So today's topic is going to be on fetus. That is the embryo which is formed into a fetus which is in the womb. So it is called as fetus. So when come into the outer world, it is called as newborn. So the topic of choice is fetal development and what are the stages of growth. So kindly stay tuned. Yeah. So within 24 hours after fertilization, the egg that will become your baby rapidly divides into many cells. So by the 8th week of pregnancy, the embryo develops into a fetus. And there are about 40 weeks to a typical pregnancy. So these weeks are divided into 3 trimesters. So when does a pregnancy start? The start of pregnancy is actually the first day of your last menstrual period. This is called the gestational age or menstrual age. So it's about 2 weeks ahead of when conception actually occurs. Though it may seem strange, the date of the first day of your last period will be an important date when determining your due date. So your healthcare provider will ask you about this date and will use it to figure out how far along you are in your pregnancy. So you should be remember your dates. So if you are still not planning to be pregnant, have the habit, or if still you are in the stage before marriage, you should have the habit of um, calculating your days or having the note of your days of your periods. So that will be helpful for the medical person, the doctor, to calculate your pregnancy days too. So how does conception work, guys? So each month your body goes through a reproductive cycle that can end in one of two ways. So you will either have a menstrual period or become pregnant. Two of the things can occur. Okay. So this cycle is continuously happening during your reproductive years, from puberty in your teen years to menopause around age 50. In a cycle that ends with pregnancy, there are several steps. First is like a group of eggs called oocytes gets ready to leave the ovary for ovulation. That is, ovulation is release of the egg. So the egg develop in small fluid-filled cysts called follicles, and think of these follicles as small containers for each immature egg. Out of this group of eggs, only one will become mature and continue on through the cycle. So this follicle then suppresses all the other follicles in the group, and the other follicles stop growing at this point because we want only one. So the other remaining, which are, see how the nature is helping us too. They form many of the ovaries. They get many of the ovum, but only one ovum is ready to get fertilized. So the other, of course, they have to compromise. So this happens in our body. So they stop growing, and the mature follicle now opens and releases the egg from the ovary, and this is ovulation. So ovulation generally happens about 2 weeks before your next menstrual period begins, and it's generally in the middle of your cycle. So after ovulation, the open, that is ruptured follicle, develops into a structure called the corpus luteum. Then this secretes the hormone progesterone and estrogen. Progesterone, what does it do? That it helps prepare the endometrium. Endometrium is like uterus, lining of the uterus. Uterus is the organ where the baby is going to stay. And this lining is place where a fertilized egg settles to develop. And if you don't become pregnant during a cycle, this lining is what is shed during your period. This is the simple thing what physiology happens. So on average, fertilization happens about 2 weeks after your last menstrual period. When the sperm penetrates the egg, changes occur in the protein coating of the egg to prevent other sperm from entering. At the moment of fertilization, your baby's genetic makeup is complete, including its sex. The gender of your baby depends on what sperm fertilizes the egg at the moment of conception. Generally, women have a genetic combination of XX and men have X and Y. So, women provide each egg with an X, and each sperm can be either an X or a Y. If the fertilized egg and sperm is a combination of an X and Y, it's a boy. If there are two X, then it's a girl. Simple. Yeah. Then what happens right after conception, guys? So within 24 hours after fertilization, the egg begins rapidly dividing into many cells. It remains in the fallopian tube for about 3 days after conception. Then the fertilized egg, called as blastocyte, continues to divide as it passes slowly through the fallopian tube to the uterus. Once there, its next job is to attach to the endometrium, and that is called as implantation. So before implantation though, the blastocytes, that is the fertilized egg, breaks out its protective covering. When the blastocyte makes contact with the endometrium, the two exchange hormones to help the blastocyte attach. Some women notice spotting, that is light bleeding, during the 1 or 2 days when implantation happens, and this is a normal and isn't something you should worry about. And at this point the endometrium becomes thicker and the cervix, that is the opening between your uterus and the birth canal, is sealed by a plug of mucus. So within 3 weeks, the blastocyte cells ultimately form a little ball or an embryo. By this time, the first nerve cell have formed. Your developing fetus has already gone through a new name changes in the first few weeks of pregnancy. Generally, it's called an embryo from conception until the 8th week of development. After the 8th week, it's called a fetus until it's born. So how early can I know I'm pregnant? So from the moment of conception, the human hormone, that is human chorionic gonadotropin, that is HCG, will be present in your blood. So this hormone is created by the cells that form the placenta, that is food source for the growing fetus, and it's also the hormone detected in a pregnancy test. That is, we pee on the strip and we get it positive because there is presence of HCG hormone. So even though this hormone is there from the beginning, it takes time for it to build within your body. So it typically takes 3 to 4 weeks after the first day of your last period for the HCG to increase enough to be detected by the pregnancy test. So whenever you miss a period and if you had a sex and you miss the period, it's not like you'll go and do the test just the next moment. You have to wait until for 1 to 2 weeks, like least 15 days, and then you have to do for the test. Then when should I reach out to my healthcare provider about a new pregnancy? So most healthcare providers will have you wait to come in for an appointment until you have had a positive home pregnancy test. So this tests are very accurate once you have enough HCG circulating through your body. This can be a few weeks after conception, and it's best to call the healthcare provider once you have a positive pregnancy test to schedule your first appointment. So yes, during this case, like, they will provide you folic acids, at least 400 mcg each day during pregnancy to make sure that the fetus neural tube, that is beginning of the brain and spine, develops correctly. Then the prenatal vitamins, you have to take it possibly. So yes guys, we were going to talk about the stages. So there was the first trimester, then comes the second trimester, and then comes the third trimester. So yes, you kindly stay tuned. In the next podcast I'll be continuing with the trimesters because the podcast is getting very long. I hope you must be enjoying it. Thank you for staying tuned. Think healthy, eat healthy, and love each other. Bye bye.